Good afternoon. Or good morning, sorry, we are saying in the morning. Morning. You're welcome to today's lecture on pharmaceutical calculations, BDT 253. And we'll continue from where we stopped in the topic, dosage calculation. Someone should volunteer. I need the course material from the phone. Let me have direction. Just open it in your phone and help me with it. I'm using my phone to record. In our last class, we solved a lot of calculations with respect to dosing. So let's see if there's any other one to solve here before we move to pediatric dosing. Before we move to what? Pediatric dosing. You know what I mean by pediatric dosing? Huh? You know what I mean by pediatric dosing? You know, right? Who knows? Pediatric dosing. Anytime you hear pediatric, what comes to your mind? Are you serious? Pediatric? Pediatric has to do with children, right? So, if you talk of pediatric dosage, then I mean dosage of drugs in what? Children. It has locked too. It has locked. Okay, so we just have lecture for like 1 hour, and I'll give you a few minutes, then I'll come back for our CA. Okay? All right. So there's another question here I want us to look at. It says, okay, our first question for today says, a patient requires an intramuscular injection of 0.5 milligram of adrenaline. Adrenaline is available as an injection containing 100 micrograms per ml. How many milliliters of injection will supply the required dose? Who can solve this question? Who can solve the question? Who? Who can solve the question? Come and solve it for us. You cannot solve it. Are you serious? Oh yeah, come. Go and solve it.
So I'm still looking at it.
Okay, I'm still looking at it. Wow. Who has done looking at it? You are chatting. What are you doing? I believe you can solve it. Go and solve for us. There's no much difference between this and what we did in the last class. It's just the same thing. Just if you understood what we did in the last class, you can solve this question. Come and solve it for us.
I'm still on it.
You're still on it. So you must solve it first in your book before come and solve it for us. Is that what? You cannot solve it. Are you serious? Okay, now let's look at the question so we don't waste our time. The question says, a patient requires an intramuscular injection of 0.5 milligram of adrenaline. Full stop. Adrenaline is available as an injection containing 100 micrograms per ml. How many milliliters of injection will supply the required dose? Remember our last class. In fact, from the first class, we agreed that drug dose is not the same thing with drug what? Strength. So from this question now, can you identify the dose and the strength? What's the dose there?
100.
Huh? What is the dose there?
100.
Is that what we discussed? That's 0.5 milligram. That's the dose. But that is the one prescribed for the patient to do what? For the patient to do what? Use. True of us. The doctor has clocked the patient and they diagnose whatever whatever ailment the patient has, and at the same time, now prescribed. Okay. And now prescribed this adrenaline intramuscular IM for the patient. True of us. And now say that the patient should use 0.5 milligrams should be administered to what? The patient. That is the dose. A dose is 0.5 milligram. Now, but the strength is the amount of drug or the concentration of drug available. True of us. So the one available probably in the pharmacy shelf or whatever is what? Is presented as what? Injection in the form in the strength of 100 microgram per what? Per mil. So 100 microgram per mil is the strength of the what? The drug. The drug itself is what? Adrenaline. While the medicine is what? Adrenaline what? Injection. Are we together? Good. Now with this at the back of our mind, I believe we can answer this question now. Oh yeah? Come and solve for us.
Microgram.
Okay.
Then it will be 0.5 divided by 1,000. Times 1,000.
Okay.
Will give me 500. Then the question will say how many must we supply the required dose. So it will be 500 divided by 100. Which is 500.
Do you know if this were to be exam, you didn't do anything? Please try to articulate your calculations, okay? Am I communicating? Yeah, try to articulate so that if you are committing an error, you know where the error is what coming from. So if this were to be an essay question where you need to state what your steps, you get nothing here. Because it doesn't make sense from nowhere. You say 0.5 times 1,000 divided by 100. What did he do? I don't know if you understand the point I'm making. So please be careful about that. You are talking to us now. Explain what actually happened. Yes, we know. So therefore, you have to move this to this. So if you move this to this, what will you get? You have, thank you, try sir, but thank you. Now look up. A patient requires an intramuscular injection of what? 0.5 milligram of what? Adrenaline. So the dose is what? 0.5 milligram what? Adrenaline. The strength, available strength is what? 100 what? Per what? Mil. What it means is that 1 mil of the injection contains what? 100 microgram of what? Adrenaline. That's the meaning. So if that is the case, if 1 mil contains what? 100 what? Microgram of what? Of what? Adrenaline. How many mil will contain the what? 0.5 what? Milligram. First of all, you move this to what? microgram. How many microgram make 1 milligram? So if 1,000 microgram make 1 milligram, that means 0.5 milligram is what? You can multiply, right? Is now 1,000 times 500 watts milligram. At the end, you have 500 watts. So basically, 0.5 watt milligram is centered as what? 0.5 milligram times what? 1,000 watts. 1,000 watts microgram over what? Over what? Over what? Okay, no problem. 1 microgram, 1,000 microgram is what? 1 milligram. So that means 100 watts. Micrograms is what? We don't know, right? So at the end, what should be here is what? 1 milligram. Milligram will do what? Cancel milligram. So at the end, we have what? 500 watts microgram. 500 watts microgram. Now, if that is the case, now, if 1 ml of adrenaline injection contains 100 microgram of what? Adrenaline, then how many ml will contain what? Will contain what? 500 what? Microgram. So X is now equal to what? You can multiply, you have what? 1 ml times what? 500 what? Microgram over what? 100 what? Microgram. Microgram will cancel microgram. This 2 0 will cancel what? This 2 0. So 5 times 1 ml is what? 5 ml. So actually, 5 ml of the injection is the volume you need to supply the required what? Dose. So 5 ml will contain what? 0.5 ml will contain what? 0.5 milligram of what? Adrenaline. So in writing out your answer, simply say that 5 ml of the injection will supply the required what? Dose. Please, while doing calculation, always follow the steps. You get why. If you make any mistake, you know where your error is what? Coming from. You may not break it down the way I did it, but try as much as possible. And don't throw your unit away, because I mark unit. I don't joke with units. I don't know if I mentioned it in this class. Have I mentioned it in this class? I don't joke with what? Units. Because you are trained to be what? Pharmacy technician. Pharmacist in the making too. You will work with what? Units. Let's assume you are working in a manufacturing outlet, for example. You go and where you should, if you weigh a particular amount of ingredient for formulation, after weighing, you not put the units. The first place there will be confusion there, because the person that weighed may not be the person that will do what? That will mix and formulate. So if you now weigh or do your calculation without putting the units, you are putting the whole team in confusion. And what if they cannot reach you? They may just close their eyes, and it's not good. So you learn how to put your what? Unit. If you solve any question or get any answer, even if what you solve is correct, once there is no unit, is 0. Once there's no unit is what? 0. As a pharmacist or pharmacy technician, you should give 0 tolerance to what? Error. Because the error you commit may cost one or more people's what? Life. True of us. As a pharmacist or a pharmacy technician, if you make a mistake, thousands or even millions may do what? Die. As a doctor, if you make a mistake, even if at all anybody will die, one person will do what? Die. True of us. because you are with one patient at a time. If you at all you make any mistake, mistake is way from you don't know it. Hope you know. If you're a doctor, you don't know it, that one is a different thing. But if you know it mistakenly, prescribe the wrong medicine or whatever. If at all anybody will die, one person, three of us, or anybody will be injured, one person. But as a technician, let's assume you are working in a manufacturing outlet. That 1 milligram you fail to write well. If the drug is a drug that is highly potent, before they know what, or maybe you misplace the ingredient you're supposed to add, you add another ingredient mistakenly. I think this one has happened sometime in the past. There's one product that they record. I get a record of the products. Maybe if a product is already in the market and they notice some error there, they will now recall. That's why it's good to have a channel of distribution, so that if there's an error, the particular batch can be recalled. They return back those ones back to the company. Now, I think they were supposed to use propylene glycol in the formulation of that tablets. I don't want to mention the name of the company. And at the end of the day, I don't know what they did. They mistakenly used ethylene glycol, and they didn't dare to people. Before they knew what was going on, lives were lost, and they had to recall the word. This is a mistake. Either pharmacist, I don't know who made a mistake in the company, just a mistake. No. Hundreds. So that's why you should give zero tolerance to error. Because you are in, it's not any harm force. You need to be articulate. You should be one dedicated, focused. You should put yourself together and be intentional in everything you are doing. Be organized. You don't need to be scattered. Don't do things anyhow. So that's why I don't give any room. If you do your calculation and if you don't get the answer, it's zero. Do you know why? The reason is this. If a patient is before you and you need to do 1 or 2 calculations before you tell the patient on how to take his or her drug, do you think there should be room for error? So where you should get 10 mil, you solve and get 5 mil, and tell the patient, because every question you are giving, I assume that you are actually the one giving this person this what? Draw. Am I communicating? Assume you are actually doing it practical, because this is a practical question. They're not abstract questions. This is a real life scenario. So assume that you are actually doing the dispensing. So there's no room for what? Error. Am I completing? You try to avoid any error. Some will say, he's just around 5 mil and he got 4 mil. Don't close your eyes and mark it. It's not true. It's not what? True. Because if your child or your sibling or any of your parents that basically the hospital, the pharmacy technician or pharmacy made a mistake, and instead of giving 10 mil, he will tell the person to take 20 mil. Wouldn't be happy with it. So why would you expect me to score you when you are doing farm card and you fail the answer? There should be no room for what? So take seriously whatever we are doing here. If your unit is not there, it's zero. There's nothing like their steps and your answer must be correct. There's nothing like mark steps now. Then that's what you are doing in mathematics in your student school. They will mark step. And when they get to the answer, they will just say, hey, you didn't get the answer. The answer has an answer. No! Because that one is general mathematics, is abstract. Am I correct? This one is not a general mathematics. It's a denominator. We are dealing with denominator number that actually represent the amount of ingredients a human being you used to produce a drug for a human being to consume, or the amount of drug a human being should do what? Take. So why would we make a mistake there? So if you see in this way, then you put yourself together and be serious with what you are doing. Take it, because the person that will fall victim of that mistake could be anybody. It can be your loved one. It can be anybody. You know, in Ebola they say that it blows onions or dikagini. You wouldn't understand until it happened to you. Siri we be shouting, hey, we don't know what those people are doing. They go to hospital, they go to the wrong drug. This is why. That's why if you fail if you get 49 in my course, I'm not adding one or half mark for you because you did what? You failed it. You're supposed to do it. You have to fail it. You're not supposed to do it. Fail it. All right, now let's continue. Let's see, but is there any question here? Any confusion here on this? It's simple, right? Forget. Okay, you have a question. Okay. No, actually, what happens is this. You know, in measurements we have different measurements, just as you have here in your what is it called? That 1,000 gram make how many gram make 1 kilogram? 1,000 grams, right? Make 1 kilogram. So the same way, 1,000 microgram make 1 what? Milligram. So if 1,000 microgram is equal to 1 milligram, the idea is that we want to convert. Before we can do anything, they must be in the same what? Units. The weights must be in the same what? Units. Am I communicating? Now we cannot have 0.5 milligram. We know that we have agreed that 1 ml contains what? 100 microgram. And how many ml we contain? We cannot use 0.5 milligram here. We must move it. Either we move this to microgram, or we move this to what? Milligram. Either of them. So we decided to move from milligram to what? Microgram. And since 1 microgram, 1,000 microgram, since 1,000 microgram, okay, let me do it here. Since 1,000 microgram is equal to what? 1 milligram. So what will be what? 0.5 milligram. We don't know, we call it what? X. So make this X the subject of the formula. So X is now equal to what? 1,000 what? Microgram times what? 0.5 what? Milligram. Over what? 1 milligram. Milligram will cancel milligram. 1 is not significant here in division because it cannot affect anything. True of us. So simply multiply 1,000 microgram. You already cancel the units. Multiply 1,000 microgram by what? 0.5. That will give us what? 500 watts. Microgram. 500 watts. Microgram, not bigger, microgram. But this one, you have moved to microgram. It will give us 500 microgram. So actually, 0.5 milligram is equal to 500 watts microgram. Does it make sense? So, let's see if there's another question we can solve here before we go to. Somebody else should help me. Okay. You know the code. All right. Thank you. So let's look for another question. Let's see if there's another question we can answer before we go to pediatric dosing. So now, as a pharmaceutical technician, you know the consequences of what? Drug overdose. Am I communicating? Be careful when you start working, when you go for your IT. I think that is the next thing you do now, right? Maybe you are there, you don't know where you see yourself. You may even be the only person there. Maybe the pharmacist is not even will not be around. Nobody will be there to assist you. Maybe they believe that one, you should have known that in school. Then secondly, they must have put you through, told you what happened in the pharmacy. Maybe they believe that you can handle it. So be careful about the dose. Am I communicating? You give. If there's something you notice in prescription from your own point of view and from what you've taught so far in dispensing, and if you notice any error, you don't need to just simply go to your pharmacist and confirm from a pharmacist then the pharmacist knows exactly what to do. Do. Are you together? Then avoid overdose. Overdose, you know that drugs are poison, right? We're told that drugs are poison. So it depends on how you handle it. It can make or mar, depending on how you do what? Handle it. So if drugs are poison, then you should stick to the what? The dose. You should stick to the what? The dosage. Am I communicating? You stick to the what? The dosage. You know, drugs, there are no drug without side effects. Are you aware? So what the side effects depend on the number of side effects may not be the same thing. But there's no drug without what? Side effects. Side effects are just what other things they are doing in the system. That is not what they are meant to do what? Do. So that thing can be positive, it can be what? Negative. It becomes adverse if it's only negative. Am I communicating? There are some side effects of drugs that they even use as if there are some drugs that are using today for a particular ailment, but actually these things that we are not the reason why they do what? Discover the drug. Maybe because they discovered the drug for something else, but because they've now seen what other things what other side effect by the side. You know, side now, side chick, yeah, side by your side as not the main thing for which the drug was what placed in the market. Now that side effect now, maybe if it's positive, depending on what they want to achieve, they will exploit it. Am I communicating? Good. There are some drugs just because they have side effect of making you to feel sleepy. True of us. It's not only what they are meant to be used for. It's not the reason why they are in the market. But some professionals will now say, okay, you cannot sleep. Oh yeah, take this one so you can sleep. We start calling it sleeping pill. There are some drugs that is not actually exactly the reason why they are in the market. If you trace their history, it's not the main reason. But because they have seen that it has this effect, and that effect, depending on what you are doing at a point in time, what you want to achieve, may become a positive what? True of us, a positive one. But adverse effect is always negative. There are nothing positive about what? Adverse what? Effects. So that one is. I just try, and the reason why I brought in side effect is because if the increase as dose you take for a particular drug increases, you also increase the side effect of you have. True of us. So if it's a drug that has a very serious issue, adverse effect, as you are taking more dose, overdose of it, we cause more much of such effect in the system. Am I communicating? So try as much as possible to give the right dose, the right time. Okay? So avoid drug overdose. This earphone, is it every second that it closes? Everybody, is it every second that it closes? All right. So now we'll look at and also I want to talk about kidney. Okay.
We should be taking appropriate, and the appropriate has side effects. Does it mean that the person should not be taking the appropriate often due to his condition or condition? Or should the person not be taking it because of the side effects?
No, there's what is called ratio. Yeah, there's what they call risk-benefit ratio. Am I completing? There's what you call risk-benefit ratio. There's no drug without side effects. So now, but if the benefit you need to achieve using that drug is more than the risk, am I completing? Then the person should, of course, you should treat yourself now. The person should treat it, but take it at normal dose. That I'm saying, because of that side effect, you should not commit the error of giving overdose because that effect will be more. That's what I'm making. Is it clear? Okay. Now, if I come like a come on. Thank you. Everybody in Now, you know about the liver, the kidney. Am I communicating? Now, just the same way you eat food, drink water, you take in, and at the end, the kidney helps you do what? Remove unwanted, right? The same way the drug we call drug xenobiotics. Drug is one of the xenobiotics. These are foreign things to your system. And if after doing their work in the system, if they are not properly eliminated from the system, if they don't properly clear from the system, they can accumulate in the system and become toxic. Am I communicating? They are not biological. They're not biological. Most of them are not biological. So most of them are what? Xenobiotic. They are. So if your kidney is not, if your kidney has issue, there's high tendency that they will do what? Accumulate. They will not clear from the system. They will accumulate and cause other issues in the body. So that's why when a patient with renal issues, renal impairments, there's what is called dosage adjustment. Most times, the physician, the pharmacist will now look at the dose they can give. It's not the normal dose a healthy person with a healthy kidney can take, that somebody with renal impairment can do what? Take. Am I communicating? That's the point I want to make here now. In renal impairment, you do what? They do what is called what? Dosage what? Adjustment. But that one is there for the physician and the pharmacist they work with to take care of that one. But just for you to be on the know, because sometimes maybe you're working somewhere, you see a drug, you know the dose, you know the dose. So you now look at the prescription, you now start seeing half of the dose. You become worried. Maybe if you're a stubborn type, you say, this doctor doesn't know what he's doing. And we are told that the dose of this drug, even them that said it, and the dose of this drug is 500 milligrams. So why is this doctor prescribing 200 milligrams? He doesn't know what he's doing. The doctor doesn't know anything about drug. You go and give 500 milligrams. You don't even know what happened. Am I communicating? And so, I'm trying to point out that there are a lot of things doctors that is seeing a patient may see, which you, dispensing drug, will not see. So if at all you notice something and you're not comfortable with it, go to a pharmacist. Am I communicating? He or she knows exactly what to do. Don't act on your own. Don't act on your own, and don't ignore. These two things are important. Don't do what? Act and give what you think is the right thing. Don't act without meeting your pharmacist, discussing your pharmacist. The pharmacist knows what to do. And don't also do what? Ignore. If you ignore, you have become a robot. Your training here is nonsense. Two of us. Because it's only a robot that carry folder and be going like this. And go and dispense a ton and go and submit. No. You look at it. From the level of your knowledge, you may notice something that is not. Nobody's above mistake. You may notice something. The doctor can make a mistake. That's why you are there. That's why they didn't employ Gateman to be the pharmacy and be dispensing drug. Two of us. That's why you are there. So you can look at it. If you notice something that is not ordinary, you can do what? Go to a pharmacist. Sir, man, look at this now. I'm not comfortable with this. What do you think about it? You say, okay, it's true. Okay, don't worry. Let me see the doctor, or go and see the doctor. Am I communicating? So these are the things you're expected to do where you're working. Don't ignore. Don't say, hey, do I even know what the doctor is doing? You know what he's doing now? Let me not dispense the way. No, that's wrong. That's wrong. And your conscience is telling you from what Muche, maybe you read somewhere in this. Maybe our farm lecturer says, maybe our AEM lecturer says something about this. You say, does it concern me? Don't worry. Maybe one day, your own person will go to the hospital. The farm lecturer will say, does it concern me? And they will give the drug like that. So don't ignore. Be empathic about it. Am I be what? Empathy about it. Feel empathy for them. Don't just do anyhow. It doesn't concern me. Let me not talk before they say that I talk to you. No. Ask question. There's one where the hospital, not here. When I was working at Immaculate Heart here. Immaculate Heart, this hospital. Here. You have to hear. I worked in 2018. When I was working there, the pharmacy technician attached to me then, I was HOD then anyway. She noticed something. A patient that there, as at that time, I don't know how they're doing it now. You those in pharmacy, you have access to folder. You actually see the diagnosis. It's not just about only prescription. So then, but I don't know if they change, and that was a wonderful thing. So when the pharmacy technician opened the folder, she looked at the diagnosis. She saw some things about diarrhea, that the patient has what? Diarrhea. Am I communicating? That the patient has what? Diarrhea. and when the person, and at the same time the person has what? Ulcer. She saw the two things on her own. I didn't even know. I was busy attending to other things. She was busy studying the folder before this person drug. She saw it. She was like, she started asking herself questions. And the drug they prescribe to treat what? Ulcer has also effect of what? What is it called? Say it. See. No. It's not miscarriage. When a patient has constipation, what do you do? When a patient has constipation, what do? You give something that will do what? Increase the bowel what? Movement. True of us? Good. What they prescribe also can help in that. Am I communicating? So he was. The lady was like, I'm not comfortable with this. How can somebody that already has what? Ulcer? There are other antacids. There are other antacids that can be given that cannot cause what? Such. Am I communicating? Now, you know most of the antacids also take care of indigestion. True of us. Are you aware? And there's tendency for them to do what? Remove a lot of things, make the person to do what? Poop. True of us. Yes. And other things, and other drugs there. She wasn't comfortable with it. She came to me and she said, sir, this patient has diarrhea. And they had seen this drug they prescribed for this patient. I'm not comfortable with this. And she was like, can the person nausea and forever? I looked at it and went, man, this is true. She was like, okay, I tell her, go and see the doctor. She was afraid. I said, no, don't be afraid. I sent you. She now left. She went to the doctor and they explained to the doctor. The doctor immediately she went to the doctor. The doctor shouted, hey! I started correcting it. He corrected it. She came back fulfilled and what? Happy. That is joy you feel if you do what? Intervene. Am I communicating? She came back happy that the doctor was able to. The doctor listened to her and corrected it. She now changed the drug. So what am I making? If she has acted like a robot, she would have done what? Only God knows what will happen to the patient. A lot of people, if you know the duty, if you know who you are in the health care team, if you know your position, whether as a pharmacy technician or as a pharmacist in the health care team, you take whatever you are doing here seriously. Be it at the hospital level, at whatever level, even in the manufacturing level, aspect, sector. If you know who you are, you take whatever you are doing here seriously and ensure you learn, you grab anything grabbable. No time to play, because a lot of lives are in your hands. In our society today, people die. Some people actually went to hospital and died. Some actually went to the hospital and do what? Went to home and died. Just instead of being cured, they do what? They went there to do what? To die due to one error or the other. You as a performance technician, you as a pharmacist, you are the last point. If there's any error in prescription, diagnosis, whatever error at the end, and it could not be traced, and the pharmacist and the patient leaves the pharmacy, he's going home. Two of us. He's going what? Home. And these things happen on daily basis. It's because here in the different part of the world we don't do autopsy now. Hey, I will go. Hey, the grandmother in the village is a witch. He's the one that did that one to her. The one that did that one to her. Even if it will be outside, they will do autopsy, find out the cause of the what? The death. So the point I'm making is this: know who you are and take whatever you are doing here seriously. A lot of lives. That's why we spend time, because sometimes the pharmacy, okay, that instance I gave, I was busy attending to other patients. I can't be there. I can't be everywhere. Three of us. I can't. And most hospitals don't even have enough capital to pay more than one pharmacist. That's a fact. To keep a pharmacist is not an easy thing. Am I communicating? So some pharmacists, some hospitals will just employ 1, 2, 3, then use pharmacy technicians, those that know what they are doing. Some even go and employ people that don't even know anything about drug. Those that know what they are doing, but they don't have the capital to do what? Money to pay more than 1, 2, 3. They will just employ and now use pharmacy technician what? Maybe about 5 or 4 attached to one. That's what they do outside the country. They will just employ 1, 2 pharmacists. They do not get pharmacy, but they know the importance of the place of a pharmacy technician in what? In this in the profession. They don't joke with it. You don't get any hard person to handle drug. No. Forget this nonsense we are doing here. And people are dying, developing kidney problems. You go to a place, they will give you. I'm talking about this dosage. We are discussing what? Dosage what? Calculation. Most of these pain analgesics, most of them, not most of them, especially NSAIDs, those ones have kidney issues. You see, you go to people, you go to chemists, those ones they call chemists. They just mixing jargons and say that they are mixing what? Drugs. They will mix. You see somebody, a dose they mix for you. Diclofenac is there. Ibuprofen is there. What else? Paracetamol is there. All the NSAIDs are there for one person. Why won't we be developing kidney issues on daily basis? Why? Tell me why we will not be developing kidney issues. Apart from that one, apart from other things nonsense we do, those that drink all this nonsense they call I don't even know what they call it. I hope at this level none of you is still entertaining more than miss anyone to those. I hope. So the point I'm making is this: every drug, before the drug is launched into the market, a lot of this there's what is called pharmacokinetic profile. They will be established with respect to the dose, the frequency, the duration, and other things. It's from the dose of the drug that the company now starts packaging or presenting their own in different strengths, so as to meet up with the dose for the drug. So that's what I want us to know in that line. So take whatever you are doing here, seriously. There's no room for what? Error. No room for what? Error. No matter what you do, nobody is perfect. But let's strive to do what? Eliminate what? Error. And the more you are intentional about it, sometimes you may not even that there may be no error at all because you are intentional about it. But if you do things anyhow, errors will definitely occur. Okay. Now, let's look at calculation of drug dosage. There's apart from the milligram, mil, as in weight, amounts in weights, mils, the strength in milligram per mil. There's also, you can also calculate the dosage of drugs. There are some drugs that appear in units that come in what? Units. There are some drugs that come in what? Units. So most of them are biological molecules, like insulin. This is a biological molecule. Two of us, like insulin. Who have seen Nkpor before? This is a popular drug they call medicine they call Nkpor. Nkpor vaccine. Who has seen it before? Good. Did you bother to check the strength? How it occurs? Now, from now onwards, it's not the way you are seeing drug before. You should be seeing drug what? Now. From now onwards, it's not the way somebody else, your friend in your house, it's not the way the person sees drug like you see the way you see what. Now, if you get a particular medicine, you look at it, study the brand name, true of us. look at the generic name, see the content, see the strength, see the expiry date, see a lot of things. This is how you're seeing drug now. So had it been you saw it with that, when last did you see camera? When last did you see it? Last week. And you didn't bother to look at it. If you look at it, the strength is in units. Just look at it, just check it. Insulin is, you are aware of insulin, right? That one is common, right? There are some vitamins that are also in what? Urethrophos, apart from vitamin C, that is milligram, right? That is the one who sees in 1 milligram. If you give vitamin A, vitamin E, if you check it, you see what? Milligram. True of us. So these things, this unit is also a measure of amount. Now, let's look at this question. This question will help us to throw more light, have a better understanding of how to handle dosages in units. Drug dosages in what? Drug dosages in what? Units. Let's look at this question. Number 2 question says, Nystatin has a recommended oral dose for adults of 500,000 units every 6 hours for the treatment of candidiasis. A suspension containing 100,000 units per ml is available. What is the total daily dose of Nystatin for an adult, and what quantity of suspension would be required for 5 days of treatment? Who can solve this question? Who can solve it? I come. Fast. Explain what you are doing now. Use that one is not acting well. I want to capture your voice, so explain what you are doing.
Nystatin is recommended giving 500,000 units every 6 hours for treatment for candidiasis, and a suspension containing 100,000 units milligram is available. The question is, what is the total daily dose of Nystatin? Why is the first question for an adult? Another question is, what quantity of suspension will be required for 5 days of treatment? For this question, we have 2 different questions to answer. And the first question is this: what is the total daily dose of Nystatin on an adult? From the question, we are told that the treatment should be taken 6 hours a day. Therefore, 6 hours a day means that the patient should be taking it 4 times a day.
I agree.
So, if the patient should be taking it 4 times a day, and if the suspension available is in 100,000, while we are recommended to give 500,000. So, for us to have this actual 500,000 to give to the patient, while we have 100,000 is to divide 500,000 from 100 to know how many should be given a day. And this 500,000, how many 100,000 do we find this 500,000? We have 5 is equals to 5. Sorry.
See what you do. Let me give it direction. See what you do. I agree with you that the every 6 hours means 4 times in a what? Because there are 24 hours in a day. So if you divide that 24 hours by 6, you have 4. So 4 times a day. Because 6 times 4 is what? 24. I agree with you. Now, but here, see what you do. Remember, that 500,000 unit is the dose, right? Remember, it's the dose. And it's this 500,000 unit that the person will take for 4 times what? In a day. Am I communicating? So that means in a day, the person needs how many units?
The person in a day, each person should be taken 4 times, and which is going to be 500. While the available one is 100,000. It means that.
Look, just settle the dose first before you now link it to the strength to know how much to give. Just settle the dose. Remember the first question said, what is the total daily dose? So find out in a day how many units does the person require in a day.
Okay. What you need is if you multiply the 500 from the multiply 4 to the 500,000
by the
which we have 4 times 500,000. We have
2 million units in a day. Either one is not acting well. Check the other one. There's a marker there. So the patient needs how many units in a day?
2 million.
2 million units in a day, right? Okay, continue. Stop throwing away your units. Put your unit there. 2 million units in a day. Yeah. Per day. Perfect. I like that. This is, hope you know that this now is daily dose. Are you aware? Are you aware? Daily dose is what? You remember when we treated dosing, we have single dose, we have daily dose. Remember, we have divided. It's actually divided, but they want you to calculate the total. That's why they put. If you watch now, this things are saying from the question is given in 4 divided doses in a day. True of us? Yes. Now we have single dose, we have divided daily dose. Remember, we have divided, right? Now this is taking 4 divided daily dose. True of us? That means 4 times in a day, right? But they're asking the total dose in a day, which is 4 times what? 500,000 units, which is what? 2 million units. So the person will take 2 million units in a day. Agreed. Now, the question now is, how would you now link these 2 million? Because you want to know. No, that's the answer. I hope you know. Yes, that's the answer. Thank you. That's even the answer. You don't even need to do any other thing again. But the aspect of the dose, not even the meal, is the what? The dose. So the daily dose is what? 2 million units is the daily dose. You've gotten the first one. Second one is what?
Second one is what quantity of suspension would be required for 5 days.
This is where you now consider the meals. True of us, the meals. But before you now go, well, they say 5 days. If the patient takes 2 million, needs 2 million units in a day, how many units will the patient need for 5 days?
For 5 days, should be 2 million times 5 days.
Good. Do it. So how many units does the patient need in 5 days? 10 million what? Units, right? Good. But they didn't ask you about the dose now. They want to know the male. True of us, the number of male that the volume, right, the quantity, right, that will contain this what, that will contain the what, 10 million what units. That's where you now go to the what, the strength given to you, because you need to know the dose before you now go to the volume that can deliver the what, the dose. You have this 10 million units is for what, 5 days, right? Now the next thing to do now is look at the strength you are given. What is the strength you are available? Good. That's what makes it strength. If you say 100,000, you're just talking about amounts. Amount and strength are not the same thing. By the time we go to concentration, you understand it better. Amount and strength are not what? The same thing. If you just say 100,000 units, just strength. It's just amount. You are there. The strength you should compare with the in this case now a suspension with the volume of the entire what system. Now here now The strength is what? 100,000 units per what? Mil. Interpret that 100,000 units per mil. Let's know whether you really know what it means. Interpret that 100,000 units per mil. What does it mean?
It means that the suspension is in 100,000 units per mil. That therefore we have to break the 500,000.
Leave that. I said interpret that. Interpret that 100,000 units per mil for us. What does it mean? If you are dealing with a patient now, most of these jargons we speak here is not a business. They want to know number of mil they will take. Three of us. Now let's assume you are with one of them that want to just learn. You now ask, what is the meaning of this 100,000 units per mil? What are you going to say? Who will help us? Okay.
It means that you take 100,000 units, you take it 5 times for once in a day. And to take once in a day, you take it 5 times.
I said you should interpret the meaning of 100,000 units per mil. Perfect. 1 mil, each mil of this suspension. Suspension is a dosage form, right? That is what we call the medicine now. Nystatin suspension is the medicine. Whereas the nystatin inside it is the what? The drug. True of us. Now, what this means that if you get 1 mil of that suspension, 1 mil will contain 100,000 units of nystatin as a drug. Am I completing? That's the meaning. So this means 1 mil of suspension is equal to 100,000 units of what? Nystatin. That's the meaning. And before you can answer this question, you must put it down. If not, you can never get the answer. Put it right, interpret it. That's why I say you should interpret it. Just simply say, but 1 mil of suspension contains 100,000 units. 1 mil contains what? 100,000 units of what? Nystatin. So now, if 1 mil will contain 100,000 units of nystatin, how many mil will contain this one you wrote here? 10 million units. Is it clear now? If this can contain, so how many mil? We call it X, will contain 10 million units. Because 10 million units is for the 5 days, right?
Yes.
So how many mil will now contain the 10 million units? We don't know. We don't know. We call it S and cross multiply and get our S. Good, perfect. I like what they're doing now. Perfect. So how many?
100 mil.
Is it 100 mil?
Yes.
Confirmed? 100,000 has how many zeros? 5 zeros. 10 million has how many zeros? 7 zeros. So you take 5 from 7. 2 zeros will remain. So it's 100 mil. So with this now, look at the question. The question said, what quantity of suspension will be required for 5 days? 100 mil of suspension will be required for what? 5 days. Simple. If I ask you what quantity will require per day, I'm asking an additional question now. What quantity will require? What quantity will require per day of suspension will require per day?
This part will be ready to go.
20 watts mil per day. If I now ask you what quantity of the suspension will require per dose? 5 watts? 5 mil? Is it 5 mil? Perfect. It's 5 mil. Because you take it 4 times a day, right? So 5 mil times 4 is 20 mil. Then for 5 days, 20 mil times 5 is 100 mil. So a dose, the quantity of suspension you need for a dose is what? 5 mil. So actually 5 mil of the suspension will contain 500,000 of what? Unit of what? Nystatin. It's not true. So 5 mil will contain 500,000 of what? Nystatin. Thank you. Any question on this? Ask a question. If Any way you're confused? Please, sir. We are solving calculations. Okay, you have them now, right?
I should have them by 12 times.
Okay. Okay, let me just round up. So you can. Any question? Okay, ask. Okay, show us what you did. Feel free. Let's learn from you. Show us what you did. Yay. Yay. How? Is it possible to do a calculation you cannot explain? Yeah. With what?
1 million is equal to 100,000.
I agree with you.
Then
Units. On other units. Please put that units.
then X is equal to 5,000 units.
Is it 500 or 500,000 units? Okay, correct. Correct, okay?
Then to find X, I cross multiply.
Perfect, okay?
X is equal to 1 million
Okay.
times 500,000 units
Okay.
over 100,000 units.
Okay.
Then units cancel with 0 cancel with 0 cancel with 0 cancel.
Is the answer?
The answer is 5 million.
I agree with you, 5 million. So 5 million contains what? 500,000 what? Units, okay?
Then I times the 5 million will be 4 doses. Like that 6 hours is 4
I put it,
doses.
yes.
Yeah. That 5 million times 4 is equal to 20 million,
Okay.
which for a day.
Okay.
Then I times the 20 million will be 5 days,
Okay.
which is 100 million.
Okay. It's okay. It's not bad. It's okay. It's okay. You started from the you started the quantity from the first dose and break it down. It's okay. There's no issue with it. It's okay. It's okay. It's okay. I think any other question? Any other question? In the absence of any question, I think I will stop here for now so you can have your lecture with Margin. So when you are done, I'll still come back for our quiz, our CA. All right, thank you very much for your attention. God bless you.